It's popular for anesthesia during surgery, but now ketamine is surging in popularity as a breakthrough treatment for depression. Ketamine isn't approved by regulators for that purpose, but clinics offer it in our community and other parts of the state. The U.S. Drug Enforcement Agency and the Centers for Disease Control are now warning people about Super K, as it's called on the streets. It made headlines across the country after the death of Friends star Matthew Perry.
You can almost tell by the look on Bradley Franklin's face that life is a bit brighter now. He's sitting next to his doctor, Harrison Irons, who's treating him with ketamine at Southern Ketamine and Wellness of Birmingham.
It's allowed me to, just conquer the day-to-day activities, whereas sometimes those felt so daunting.
Dr. Harrison tells me studies show ketamine given in small doses over time works miracles for people battling treatment-resistant depression, PTSD, and anxiety.
Even the hardest to treat people, we still see a response rate of about 80% in remission of symptoms.
Many anesthesiologists use ketamine as anesthesia for patients. It has been allowed for surgical use since the 1970s. 5 years ago, the FDA gave this ketamine-like nasal spray, Spravato, its stamp of approval to help people struggling with severe depression and the risk of suicide. But it did not approve intravenous ketamine therapy. Still, over the last decade, nearly 1,000 ketamine clinics like Synergy in Huntsville opened up across the country to offer it.
We primarily use it for the treatment of refractory depression. It can also be used for acute pain crises. If somebody has a fracture or they have an abscess, we may use low dose.
Dr. Fierro says the medicine in these little vials create a feeling of separation of the mind and body.
It causes multiple regions of the brain to start firing at the same time. And that's where the vivid thoughts and vivid dreams come from.
Receiving ketamine therapy can result in frightening hallucinations.
And they will stop 10 to 20 minutes after the infusion is over.
Now there's a black market for ketamine, aka cat tranquilizer, and it's becoming more popular on the streets and on the scenes of nightclubs.
It's imported from other countries. Sometimes it's diverted from veterinary clinics, maybe even be diverted from hospitals and medical clinics.
Of course, Friends actor Matthew Perry died last October from, quote, acute effects of anesthetic ketamine, according to this autopsy report. Friends of the 54-year-old say Perry received ketamine infusion therapy for depression close to 2 weeks before his death. But the autopsy report revealed levels of the drug in Perry's body similar to the amount of a person prepping for surgery.
When put in the wrong hands of someone who's just got a long history of addiction, like Matthew Perry did, unfortunately, it sounds like he presumably ingested ketamine in some way, shape, or form, and then decided to go swimming, which, of course, is certainly not advised.
Landon McLean lives and works in the area and says this about Perry's untimely death.
I wasn't surprised because I know there's a potential for abuse of ketamine.
Dr. McLean says he administers ketamine almost daily here at McLean Surgical Arts in Huntsville.
The doses I use in the office are what we call ultra low dose or almost micro doses, but obviously any sedative or general anesthetic used without a doctor's supervision can be potentially deadly.
Ketamine has its benefits and is working for people like Bradley Franklin, but unfortunately can be life-threatening for people like Matthew Perry, battling both depression and addiction demons.
Your disease is just outside, just doing one-arm push-ups, just waiting for you, waiting to get you alone. Because alone, you lose.
To be clear, ketamine is listed as one cause of Matthew Perry's death. His autopsy report says coronary artery disease and a drug to help fight opioid addiction also played a part in his demise. And the debate over ketamine continues. We have digital extras for you at our website, waytv.com. Huntsville police open up about reports of ketamine abuse here in our area. I also have more details on the benefits and dangers of the drug, including data on the number of teenagers who abuse the drug. After you've read the article, take the survey and tell me if you think the FDA should approve ketamine treatment for psychiatric disorders. You could see your responses here on air.